I'm responsible for making sure patients get in for their consults, for them getting their simulations prior to treatment, their whole treatment process, and their follow-up process. Radiation therapy is the use of high-energy particles delivered through a treatment machine called a linear accelerator. That machine produces radiation, which is then directed out of the machine into the patient. Navigating through radiation oncology, there are certain points that have to happen. Those points are, first, a consultation. Patient is brought into the department to meet with one of our radiation oncologists. That meeting is going over the patient's chart. If radiation is determined to be a course of treatment, your next appointment would be a simulation. The simulation is the treatment planning part of the process. Everything that we do here in radiation oncology is precise to millimeters. Patient is brought into a CAT scanner that we have in our department. They're set up comfortably, and the CAT scan is then taken at that time. Our physician, radiation oncologist, uses that CAT scan to actually plan the radiation treatment. When patients come in for their first day of treatment, we do what we call a drive run. Every patient is set up on the table. They're set up in their position. We take regular x-rays to verify everything that was done from that CAT scan simulation, transfer it to the machine correctly, and it's exactly where the doctor wants it. So before we turn that machine on, we know, we are 100% sure it's going to deliver what we want it to deliver, where we want it to deliver. After that, patient comes in on a daily basis for the radiation treatment. They get into the routine of checking in at our front desk. They are then greeted by the radiation therapist, taken into the room, set up for their treatment. Treatment is delivered, and then the patient is free to go and enjoy the rest of their day. Here at Hunterdon, we have the latest technology in regards to radiation therapy treatment. The ability of the machine allows us to treat cancers or tumor sites within millimeters. It allows us to tailor our dose to ensure that we are not radiating normal tissue. The staff between radiation oncology and medical oncology work very hard to ensure that when a patient comes into our doors, they're there for one visit. In that one visit, we can encompass the radiation treatment and the chemotherapy treatment. The length of radiation treatment does vary. We have courses of treatment that are 3 days, 5 days, up until 7 weeks. That is all determined by the radiation oncologist. As far as daily times on the treatment machine, that can vary. Some treatment courses are 5 minutes, some treatment courses are 25 minutes. That is all dependent on the site that we're treating and what protocol we're actually using to treat. Hunterdon is different because of the family that we have here. We have a very highly educated, highly motivated staff here, and everyone's main job is patient first. I walk down the halls and I see patients that I've treated personally, that I know my staff have treated months, years down the road. I see them in the hallway. They know me by first name, I know them by first name. We have that relationship. That's my day. When I can walk down the hall and see a patient that I treated, or even someone on treatment, and they're smiling and they know that we are there to help them, that's a good day to me. And I have a good day every day.